Okay, let's do a quick review of valve disorders. And you can look at your concept map or your ebook for more information. So some of the terms you'll see with valve disorders are the term stenosis. This happens when the valve doesn't open properly, or regurgitation, and that's when it doesn't close properly, so it lets some of the blood flow back. So the other important concept to remember is that some of your symptoms are going to be dependent on which valve is affected. So remember, you've got the mitral, the pulmonic, aortic, tricuspid. So this is what we're talking about when we talk about the different valve disorders of the heart. So some of your priority assessment that you're going to be looking for are listening for those heart sounds, and that's where with these disorders you will hear murmurs or possibly extra heart sounds such as the S3, S4. If they are on telemetry monitor, or if they have a 12 lead, you might see PVCs with these patients, or pulse irregularities. You do want to make sure in your assessment that you're looking for any signs of poor perfusion. So check those peripheral pulses, check skin color, temperature, look at level of consciousness, urine output, ask about any chest pain, bloody sputum, shortness of breath, fatigue, if they feel palpitations, orthopnea, presence of edema, or dizziness. The way we're going to diagnose this, you'll see multiple things done. You'll typically look at, you'll see chest x-ray, CT, CBC. You'll have an ECG or 12 lead done to look for any changes. And then you might see an echo done, and typically it's diagnosed with, like that cardiac echo, and it might be done like that transesophageal. So remember, with the echo, they can place that ultrasound probe externally, or they can go down through and do that transesophageal through the esophagus. Our priority interventions or actions that we're going to do are we're going to give meds to treat or prevent heart failure. So again, this ties in with our heart failure. We may be preparing and doing education on valve replacement. And again, a lot of these can be done. The surgery for valve replacement is percutaneous valve replacement or percutaneous transluminal valvuloplasty. And sometimes if it can't be done that way, they may have it opened up. We'll also, with these patients, see that they're placed on anticoagulant therapy. If they have a mechanical valve, it's going to be for life. And if they have a prosthetic valve, it's usually around 3 to 6 months. Your complications that you are looking for is with mitral stenosis, AFib, or emboli, which can lead to stroke. With mitral regurgitation, we want to look at the size of the left ventricle, and then we might see it enlarged or some pulmonary edema. With aortic stenosis, we're worried about aortic dissection or sudden cardiovascular collapse or death. These patients are also risk for endocarditis with them, and then some of those valve repair surgeries they're at risk for pulmonary emboli. So if they're on anticoagulants, we want to be nursing implications are to assess for any of those bleeding precautions, fall precautions, symptoms of heart failure. These patients will require, teaching regarding the new medication or pre-procedure, preoperative, postoperative teaching. Meds that you'll see are vasodilators such as nitroglycerin. Make sure, like if they're on nitro, that you're watching for hypotension. These patients are at risk for syncope, falls. Patients will be on antibiotics to prevent endocarditis. And again, You'll see with valve disorders that they may need antibiotics prior to dental procedures or surgical procedures. This is something that research is currently being done on and may evolve. In the past, these patients always required prophylactic antibiotic therapy before dental procedures or surgical procedures, but they are actually doing research to see if that is still best practice, because now that we're seeing about all the antibiotic resistance bacteria, we really are trying to get that data to really see if that's still a good practice. So that will be dependent on the cardiologist. We'll see beta blockers used, and with anticoagulants such as Coumadin. So think about the teaching dietary and lab monitoring you would need for Coumadin. And you might also see more use of those NOACs, the novel oral anticoagulants. So we're seeing more of those, and many of those do not have that lab therapy. You might also see them on any of the coagulants like enoxaparin or Lovenox. So whatever's ordered, you want to be prepared to do the teaching for that. Education, if they're smokers, you want to educate them to stop smoking. We want to think about exercise that they can tolerate so that they maintain their strength. And then again, see what the healthcare provider's recommendations are as far as prophylactic antibiotic, treatment, limit caffeine. They need education on signs of heart failure. So go back to that video or reading in your book or lessons if you have any questions on that. And then they also need education on anticoagulant therapy.